me signifies that there's something going on in their brain. That was a significant difference between people who were treated for 3 months with Accutane versus those who were treated for 3 months with antibiotic. And the fact that it was significant in only 28 people shows to me that there was a strong association there. The manufacturer of Accutane, Roche, attempted to get that article retracted and accused me of fraud to my university, but they were unsuccessful in doing so because there was no fraud. The fact is that this drug can have an effect on brain function, and we showed that in that study. There's plenty of other evidence which I reviewed in a paper I wrote most recently, 2021, in the Journal of Personalized Medicine called Isotretinoin and Neuropsychiatric Side Effects. Continued vigilance is needed. You can find it just by Googling that title, and there's links to a number of the papers I've referenced in that, in that paper. Other evidence that it affects the brain is from animal studies. Like Callie O'Reilly, writing in the journal Neuropsychopharmacology in 2006, showed that Accutane or isotretinoin can cause depression-type behaviors in mice. And then Peter McCaffrey and James Crandall, writing in the Proceedings of the National Academy of Sciences, USA, showed that it inhibits nerve growth in a part of the brain we know is involved in depression called the hippocampus. And there's many other studies showing that it has effects on neurobiology in the brain. It is part of this superreceptor superfamily, which includes other compounds like thyroid hormone, glucocorticoids, and sex steroids that go into the receptor and they bind to the nucleus and cause gene transcription. That's why it's such an important, dangerous risk for birth defects, because it can affect the gene transcription in the developing embryo. If you want to learn more about some of the things I've talked about, I'll put a link to the paper that I wrote, which is you can download for free online. Thanks for listening.